allow doctors to predict heart attacks as early as 5 years in advance. That's amazing. Here to explain the new life-saving technology, family physician and assistant professor at Rowan University School of Osteopathic Medicine, Dr. Jennifer Caudle. Doctor, thank you so much for coming on this morning.
Absolutely.
That's a huge thing, 5 years in advance to know it's coming.
When we're talking about heart disease, it's such a big deal, right? Because we know that heart disease is the leading cause of death for men and women. So anytime we have the chance to kind of really know what we're looking at, I think it's a good thing. You know, there was a study done, and actually researchers are looking at technology that would enhance CT technology that we have right now. The idea is it would look at the fat around blood vessels that are around the heart. And that could predict, potentially, how great at risk someone is for having heart problems down the line. Now, we still have further work to go, and there's still more studies we need, but it's a really interesting concept, absolutely.
That is just fascinating, and it's all about that, right? As soon as that thing clogs up, there's the heart attack. It just stops flowing, and there you go.
Yeah, that's what heart attacks are, and so we really want to be very cautious about that. And so this technology potentially
they can look inside and see inside a blood vessel. I mean, this is amazing to me.
And outside as well to see the fat, which often implies inflammation, which is where we think the chance and the risk of heart attack may increase as a result of or be associated with. So there's still lots of questions, but it's still very, very interesting and exciting.
It's great stuff. Amazing advances.
Yes.
Okay. Red meat and cheese are good for you?
Well,
are we sure?
I mean, okay, and don't you feel like every other day there's a new diet study coming out? I mean, I have to be honest with you, as a physician, I feel that way. But Labor Day is around the corner, and I think some people would probably like to hear this news, which is a recent study. It's not a slam dunk study, which means it shows a connection, doesn't show cause and effect, but suggests that perhaps lower carbohydrates but higher fats may actually help with mortality. So that's things like meats and cheeses. But this is my caution, okay? My thing is before you go out and eat all the meat and cheese you can find, I still think it's really dependent on each person. I still think we need a balanced diet with fruits and veggies and things like that. And know that this is evolving data, right? These studies we get, and it's just adding to our whole picture. So this is one piece.
Yeah, I mean, if we're talking about heart health, as we did in the first story,
just did, right,
you don't want to pile on as much red meat as you can.
Well, right. But some studies are actually suggesting that, you know, maybe red meat is not so bad for the heart. But this is the questions that we're trying to answer. I say for right now, stick to that balanced diet. I'm still a low fat, you know, low carb, fiber, and, you know, healthy, lean protein type of girl. That's what I'm recommending to my patients.
Okay, that makes sense.
Yeah.
All right, the last one here is nuts. What, 6 cups of coffee a day?
Well,
come on.
I know.
You'd be totally cracked out. What would you do?
I know. So they're saying that, you know, 6 cups of coffee could potentially lead to a longer life. And once again, this is another study that's what we call not a cause and effect study, meaning it doesn't prove that drinking 6 cups will make you live longer. But is there a link? You know, this is the thing. We often see studies about caffeine too, you know. Is caffeine good for you? Is it not good for you? I say with this, I'm going, you know, I'm sort of old-fashioned. I'm an old-school family doc. I say everything in moderation. Remember, caffeine can have other side effects, okay? And again, it's not a proven thing. We just think there may be a connection or a link. We still have to look into this further. So, yeah, use some common sense.
That's insane. I don't drink coffee. If you gave me 6 cups, I'd be able to see through walls.
Really? You'd be on the ceiling, wouldn't you?
I would be. I've never heard anything like that. All right, doctor, thank you so much.
Thank you. It's good to see you.
Go get some coffee, I guess.